Hi everyone. I wanted to talk about perspective. And when we join medical school, most of our goals are to serve patients. And, you know, throughout the years, we kind of sometimes lose sight of the real reason why we chose medicine. And, we start studying, we do a lot of administrative work, there is politics involved. You have to make decisions for your subspecialty training, and you have to decide what motivates you towards one specialty versus the other. And so it's very normal to lose sight of that perspective. So I wanted to share my ideologies and philosophies on treating patients and my thoughts about the practice of medicine. So, um, the first philosophy or idea that I have is that when we treat patients, imagine that if this patient was your relative, how would you treat them? And when you're seeing your 20th or 30th or 100th patient of the day, if that patient was your mom or your dad, would you treat them the same way? Would you talk to them the same way? And I know there are inherent biases when a patient is a relative, and most of the times we don't end up treating our relatives. But the fact that if you're cognizant of that, thinking about each patient as your relative, you might be able to treat them better and give them better care. And I can think of a situation that recently happened where my resident was like, I need to call the patient's relatives again. They keep calling and there is no real update to give them. And I just told him the same thing, that if imagine you were that relative whose mom or dad or wife was admitted in the hospital, would you not like a phone call from the physician who is treating your relative every day, even if it's a short phone call with a small update? And that's why I tend to call the relatives, or at least speak to them every day for like 1 or 2 minutes. And if they have questions, you can give them more time, or you can say, well, I don't have the time right now, but I can talk to you later, in a nice and polite way. And that can really help them feel more confident in you. The second thing I wanted to talk about is knowledge. So we need to work really hard to keep our knowledge up to date, and then constantly keep reading, because if you don't know, you can't treat a patient. And that's why we work so hard. We do all of these research, and there's just so much literature out there, and it keeps updating every day. So if that's one of my perspectives, is that if you don't keep reading, you're not going to be able to provide the best care to your patients. And that's why we need to work so hard and read and memorize and keep learning. And the cycle of learning never ends as a physician. And the last philosophy I wanted to share was to always have good vibes, good energy around you, to be curious and always seek knowledge, to be positive and have a optimistic perspective on life. And That's because life is already so hard and we don't need to make it harder on ourselves. So enjoy what you do and do it with a smile on your face. I have this saying that I wrote on my whiteboard a couple of weeks ago, and it says, "You're standing in front of a miracle, and once you realize it, it will change your perspective." I'm not sure where I read this quote on. I think I saw it on Doctor Who in one of the episodes, and it's such a deep saying. Um, you know, for recognizing a miracle is very important, and that miracle might be the opportunity to study medicine or to be in that medical school or that university that you're in, because some other kid may not even have that opportunity, and for them you are living the dream life. You are the miracle, or the thing that you have is a miracle for them. And so once you realize that, you change your perspective and you don't become negative. You once you change your perspective, it like shifts your mood, shifts your emotion, and you realize that what you have is a huge opportunity, and perhaps someone else would love to be in your position today. And that's all. Stay awesome and enjoy learning.